Hello and welcome to Our American States, a podcast from the National Conference of State Legislatures. I'm your host, Ed Smith.
Predicting is trying to tell you what's going to happen. Forecasting is trying to tell you for anything that could happen, how likely is it to happen.
That was Dr. Roni Rosenfeld, a leader in the field of disease forecasting and my guest on the podcast. Rosenfeld is a computer scientist who heads the machine learning department at Carnegie Mellon University in Pittsburgh and is a professor in the department. He also works with Carnegie Mellon's Delphi research group, which is one of several organizations that are part of the newly developed Outbreak Analytics and Disease Modeling Network established by the Centers for Disease Control and Prevention. Rosenfeld explained that over more than a decade, researchers working on disease forecasting have taken weather forecasting as their model in creating tools to better understand the path of infectious diseases. He explained the type of data disease forecasters use, everything from hospital records to Google searches, to develop their forecasts and how that information can help those in healthcare. He also discussed why it's important for legislators and others in state government to understand how to use and interpret disease forecasting. Here's our discussion. Roni, welcome to the podcast.
Thank you. Pleasure to be here.
So, to get started, tell the listeners a little bit about your background and how you got into the field of disease forecasting.
Sure. My initial training is in physics and mathematics. I then did a PhD in computer science and statistical modeling. I've been working in computer science and machine learning for the last 30 years or so. About 15 years ago, I started studying virology and immunology, which led me to epidemiology. At the time, I noticed that there was a vast and established science of epidemiology, but that the technological aspect of it was not as well developed. So it's a little bit like having a science of weather, of how weather evolves and understanding weather, but not having the weather forecasting technology to come with it. And that's what drew me in to work on epidemiological forecasting. We were very pleased to learn recently that our Delphi research group, of which I'm part, will be a network partner with the new CDC Center for Forecasting and Outbreak Analytics.
As I understand it, there's a big distinction between predicting and forecasting, even though most of us use those terms interchangeably. Can you talk about what the difference is and why forecasting is more useful in making decisions, particularly for setting policy?
Sure. So predicting is trying to tell you what's going to happen. Forecasting is trying to tell you for anything that could happen, how likely is it to happen. And in some sense, predicting is more attractive because people really want to know what's going to happen. And if they had their druthers, they would just have you tell me what's going to happen. But the reality is that very often, usually, we can't tell people what's going to happen. There's a significant amount of uncertainty in a situation that we cannot commit to. And in a sense, it's more helpful, if you think about it, to tell you the truth, which is multiple things can happen, but some of them are more likely than others. And how much more likely is important. Sometimes something has only a 5% chance of happening, but if the repercussions are severe, you want to know that and you want to take action, even though it's only 5%. But if you knew it was not 5%, but 0.01%, that's a completely different story, right? So knowing how likely things are to happen, even when they are less than 50% likely to happen, is quite useful. And that's what we're trying to provide.
So, along with forecasting, there's also scenario modeling and nowcasting. Can you break those down for us and explain how each is used depending on the stage of a disease outbreak?
Sure. So it might be easiest to do it again in comparison with weather forecasting, which has really been an inspiration for our work over the last decade. In weather forecasting, knowing what the weather is right now is not difficult. What you need is to measure the temperature and the wind direction and strength and humidity and so forth, and to measure it all over the world. It sounds, it's obviously not logistically easy, but it's been done. It's done through international collaboration. It's not scientifically difficult to know what the state of the weather is right now in the world, and then Weather forecasting is free to take that state and try to project it forward to see what it will be an hour from now, a day from now, a week from now. In epidemiology, actually, it is nearly impossible. It's practically impossible to know what the current state of the world is. Nobody really knows how many people are infected with a particular virus in a particular city at a particular week. The uncertainty in weather forecasting is only about the future. The uncertainty in epidemic forecasting is also about the present and even the past. So nowcasting is basically about quote unquote forecasting the present, trying to understand and to estimate to the most accurate in the most accurate way possible what is the current state of an epidemic or pandemic, what is the current state of infection, of prevalence of a particular disease, incidence of the disease, and so forth. And it's not only useful for making decisions that have to do with what is the current situation, but it's also a necessary condition for being able to do a good job on forecasting the future. Because if you don't know the present, it is that much harder to know what the future would be like. You mentioned scenario modeling. Scenario modeling is a form of forecasting, but it's conditional forecasting. It's asking the question, rather than tell me how likely are different things to happen, it's asking how likely are different things to happen, assuming this happens or this doesn't happen. So I'll give you an example. We may be able to give you pretty good estimates of how bad things are going to be with regard to, say, hospital load or load on the healthcare system under the current particular strain of a virus of infectious disease. But there's always a chance that there will be a mutation and it would, wreak havoc on the whole situation. You might want to estimate how likely that is to happen, but it's a separate problem. And sometimes you can do it, sometimes you cannot. Sometimes it's useful to say, if there is no new variant, hospitals should be able to handle this fine. If there's new variant, I don't know. And this I don't know part is actually quite important, and it's something that sets forecasting apart from prediction. It's really important to know when you know and when you don't know, and to be able to express that very clearly. And it's not usually black or white. Sometimes you feel like the situation is fairly well understood and the forecasts are quite good. And sometimes you think they're not very good, they don't have enough data to be based on, and you would rather just say, I don't know. In scenario modeling, it's a sort of acknowledgement that some things, some future developments we don't know about, and we will tell you what we think will happen under each one of them.
I think for those of us who are not scientists, it's sometimes difficult to accept that the answer is, we don't know.
Absolutely, but it's so important, and it's so important for us. It's so important for us to resist the temptation to provide an answer under any circumstances, and only provide it when we feel that we have a basis for it.
Can you talk about how you develop these forecasts and what sort of data and data sets you use to make these decisions?
So over the last 10 years, a large part of what we have done is seek out data sources that help shed light on the current state of any epidemic and on its recent past, so that you can try to project that into the future. So there are a variety of data sources, and the more you have, the more robust your system is, the more reliable it is. So I'll just give you a few examples. There's the standard data streams that most people are familiar with post-pandemic, such as the reporting of cases, reporting of hospitalizations, and of deaths from a particular pathogen. These are quite helpful, but they don't give you the full picture. We know that they are limited. We know that they capture some things and not others. They can be biased at times, and they're not always available in real time. Other data sources can play a complementary role to sort of robustify your understanding, triangulate your understanding, cross-check to make sure that the picture you get from other readings are consistent with what you get from these main public health reporting. So things like the frequency with which people search the web for different topics. So search query volume, the kind of signals that Google puts out in aggregate for large cities or states saying what fraction of queries were about a particular condition. Has been shown to be very strongly correlated with how many people actually suffer from this condition. So that's one example. Another example would be over-the-counter products sales. How many thermometers are being sold in a particular city in a particular week? Now, you might think that if I'm sick, I don't buy a thermometer because I have one at home. But it's also true that when people do buy a thermometer, it's usually because not only they don't have it, but they have an acute need for it. So again, it has been shown that there's very strong correlation between thermometer sales and febrile illnesses. These are two examples. Another example would be anonymous data from testing companies that provide tests for a variety of like flu or COVID or other diseases. Other sources would be aggregated statistics from insurance claims. If you check to see how many times insurance claims were filed for particular conditions, look only at the numbers of how many were filed in a particular region, use that as a signal. It's a very informative signal. So we gather maybe 10 different signals from 10 different sources, add to them the cases and hospitalizations and deaths reported by public health officials, and you get a much more robust and actually a much more accurate picture of where things are.
I suppose no matter how good the forecasting is, it's not very useful if it doesn't spur a whole bunch of people to take action, getting ready before there is a disease outbreak, or maybe just knowing how to better respond to one that's already existing. So how does it move from having a forecast to having healthcare resources ready to respond?
So there are a variety of decision points that public health officials face that would benefit from having better nowcasts and better forecasts. One common one that happens even in non-emergencies is timing of different public health campaigns. When should you send reminders to pharmacies to stock up on certain products? When should you start public health campaigns to educate people to vaccinate themselves, especially vulnerable populations, before a wave of, say, flu comes around? A lot of what public health does is communication and education to their stakeholders. And that communication has to be timed right because of the limited attention span of people, because of wanting to hit things just at the right time. So communication is one thing. Another very important area of decision making is in planning capacity, especially at a time like this when the healthcare industry is suffering from a severe shortage of healthcare personnel. It's very important to know when they would be needed so you don't schedule elective surgery at the wrong time and then find out that you're out of beds, or schedule vacations, or make sure you have the right equipment at the right place. Capacity issues can benefit tremendously from forecasts. And then, of course, interventions. That's much harder because we're not providing direct information on how different interventions would affect the state of an epidemic or a pandemic, but scenario modeling does some of that.
Thanks, Roni. We'll be right back with the rest of our discussion after this short break.
NCSL Basecamp is back for 2023. Join your colleagues online November 8th and 9th for a next-level learning experience. Basecamp provides legislative-specific professional development and unique opportunities to engage with national policy experts. Attend sessions in real time or access the recordings for up to 30 days. Register now at ncsl.org/basecamp23.
I'm back with Dr. Roni Rosenfeld discussing disease forecasting. Roni, I've asked this question of a lot of people on this podcast, and I think you are the perfect person to ask. What lessons did you take away from the pandemic? I'm sure there were a lot of them, but just in terms of how to be better prepared, what were the big takeaways for you?
Yes, quite a few things, and we're still working on them, but I can share a few of them with you. One is that our forecasts are only as good as the data we have. We've made tremendous progress over the last 10 years in identifying and procuring new data sources, and in also analyzing the data sources we have and understanding them better, because often data is not what you think it is until you actually dig in and do the statistical analysis. So we've gotten to a pretty good point, but I think we can do better. And a lot of what I see my group is doing is seeking out additional data sources. The more data we have, the more accurate both our nowcasts and our forecasts are going to be. In that regard, I would say we are behind weather forecasting. Well, they started quite a few decades before us, but they've made steady progress over the years, not just with the algorithms, but also with their methods for acquiring the data. The other point I would make is the importance of communication, not only just for public health, we talked about it, but for our sort of our own forecasting work, explaining, as we've done in this podcast, what is it that we're trying to achieve with forecasting? What are we basing it on? When CDC puts out their own forecast, they're not just asking somebody to squint and tell them what they think. It's based on a thorough process of consultation with a variety of data sources, a variety of modeling groups, trying to reach a consensus view that sort of integrates all of this information in. All of this needs to not just be communicated, but also to be clear. We need to build trust in these messages. We need to show people in non-emergency times that these things are useful, and they can be useful on a daily basis, and they could be doubly useful during an emergency.
So our audience is, of course, largely legislators, state legislative staff, other people interested in state policy. And I wonder, for that group, people who are looking at what their policy role is in this, what would you share with them? What should they know about disease forecasting?
A few things. One is I would re-emphasize my last point about trust. We need to build trust in the community that does the forecasting, in its track record, in its ability. There is a tendency to be drawn to outlandish predictions, especially during an emergency when people are desperate for a definite answer of what's going to happen. You need to resist that temptation and listen to people who've been producing these forecasts consistently for a long period of time, and you have a track record of how well they did. The other thing I would say is the need for data, the education and understanding that these forecasts are only as good as the data they're based on, and that we need to make sure that the public good in the form of aggregated statistics is not impeded, so that we put together the policy and legal mechanisms for making these data available to make forecasts.
To follow up on that last question and to wrap up, I wonder what the general public ought to know about disease forecasting.
I would like it very much if the general public knew that disease forecasting has been developing as a technology for over a decade now, that it's gotten to a place where I think it's useful in a variety of situations, and that it can be made much more useful still with additional data. The use of disease forecasting is not just for public health officials, but also for individuals and for a variety of organizations that have to make decisions, just like you have to make a decision about rain. Is it going to rain? And you're not told whether it's going to rain or not. You're told, is it a 90% chance or a 20% chance it will rain? And then you make your own decision. The same way, and maybe arguably more meaningfully, if you are told as an individual, as a member of a medically sensitive group, or as a child of an elderly person who's trying to help them make decisions, if you know what the level of risk that you can expect for your loved one at a certain time, you can help you and them make informed decisions. The same is true for large organizations, make decisions for their employees.
I think we all listen to the weather forecast every day, and it seems perfectly normal. So that it ought to be just as normal, I think, to listen to a disease forecast. Thank you so much. I wonder, is there anything else you'd like to share with the listeners before we say goodbye?
We all hear about the flu season coming, and we know that it's a fairly large season starting sometime in September, October, and lasting until March or April. But very few people know that actually a particular wave of flu that typically comes in the winter comes over a fairly short period of time, 6 to 8 weeks, during which most of the cases, most of the hospitalizations and deaths due to flu happen. One of the things that forecasting and nowcasting can help with is making people aware of when that flu wave is coming and help them sharpen their decision about, I don't want to avoid crowded places for the entire 6-month period. But if I'm immunocompromised or very frail, I might choose to avoid it for 4 to 6 weeks.
Yeah, that is a very good concrete example. And I think everyone is much more attuned to that after a couple of years of the pandemic than they were before. So I think that's very helpful. Roni, thank you so much for taking the time to do this. Take care.
Thank you.
I've been talking with Dr. Roni Rosenfeld of Carnegie Mellon University about disease forecasting and how it can help healthcare providers in states be better prepared to deal with infectious disease outbreaks. Thanks for listening. You can check out all the podcasts from the National Conference of State Legislators by searching for NCSL Podcasts wherever you get your podcasts. Tim Story, NCSL's CEO, hosts Legislators, the Inside Story, where he focuses on leadership and legislatures. The Our American States podcast dives into some of the most challenging public policy issues facing legislators. On Across the Aisle, host Kelly Griffin tells stories of bipartisanship. Also, check out our special series, Building Democracy, on the history of legislatures.